me. My name is Falake Kofoido. I'm a medical doctor. I am the founder of EAO, that is a tech-enabled startup based in Lagos, Nigeria, and we provide community-based primary care for people in the informal sector. And I am one of the participants in the first cohort of the Business Growth Initiative for Startups. I'm very excited, to be doing this with Just for Women Africa.
What inspired you to start EAO?
I was inspired to start EAO out of the need to build a sustainable way or a sustainable model platform that provides comprehensive healthcare for people, most of the people who had adequate, or what we would seem as adequate, health coverage, got that through their employers. And that's mostly large corporate organizations or large enterprise. Many people with nano, micro, small businesses do not get that opportunity, even though the Nigerian government is pushing now, mandating health insurance, but there are no systems in place still to enforce that and also to implement that properly in a way that works well for people. And so just seeing the problems and the enormity and disease burdens and our poor health outcomes that are stemming from things that are very preventable, easily preventable, that if we had good primary care would be able to solve. And that's why I thought, okay, let's dial it back. Because if you're looking in research, they talk about doing a root cause analysis. And for each layer, you just ask why. And you peel back and you keep asking why. And at the end of the day, it is because little things are not taken care of when they are small and early and cheap. And then it grows to become a big problem, and somebody is now raising millions for a kidney problem, or they die suddenly and their family is in financial ruin and all of those kind of things. So it's basically taking it back to base one and see how can we solve small problems early and for cheaper.
Can you tell us more about the telemedicine and mobile clinic model works at EAO?
So for us at EAO, we are a brick and click model, which is hybrid. We're not fully digital, but we're also not fully traditional, which is in person. Because we're community based, we really still have to interact with the clients. And because we're dealing with people in the informal sector, not all of them are digitally literate, digitally savvy, or even there are people who don't even have cell phones. So we're almost the physical first and then digital second company. However, our operations are tech enabled. So the people we serve market women, we serve other SME owners. So for market women, our telemedicine is support powered, wherein if they have family members who can help them, that would be great. But if not, our community health worker that goes to them every week for their visits is able to use telemedicine to escalate care. They have a protocol that they follow, and if the challenge or the problem they are encountering is not something they can solve, or they need additional support, then they can use the telemedicine to escalate to our doctors. So that's mostly how it works for the bulk. We also have non SME owners who are not physically in the market, and those are a bit more savvy or user literate for technology, and they are able to use the telemedicine platform to click the button and dial or request a meeting with the doctor. Also, we have WhatsApp channels that we use to serve our customers, and some of that is text based. A good amount of that also is voice message based. Keep in mind that we're dealing with the lower rung of society and just the economy. There are people who prefer, or it's easier for them to communicate in their local language. Texting may not be able to accommodate that, but when they send a voice note, that is something that even if the person who is immediately receiving it does not fully understand, they can transfer it to someone else, and that information is still intact. It's not a he said, she said. It's This is what the person says, and it's play and you listen. Our clinic is more of a pop-up clinic rather than a mobile clinic, just if we're being technical, because mobile would indicate something that is mounted on a vehicle, tires, and moving about. So we do more of a pop-up clinic, and we have the first one coming up in December 13th in Oimbo Market. And basically it's trying to bring as much of the primary health care to the people. There's a limit to what the community health worker can do with a bag on their arm. And so it's that we know they need more. And so periodically, once we gather or amass a certain number of people, then we will institute a pop-up clinic. And it's almost like a regular clinic. You know, you have EKG, they have weighing scales, they have a medication dispensing list, they have eye checks, and all of that that's put in there. We have cervical cancer screening also included, counseling, so many other things that we've included there. But it is what is going to now be done within their community. It's not normally there. So we put up a temporary structure and set up for the day or for 2 days. And we do what we need to do. I encourage as many people as possible to participate. And we're done. And then after that, we can now do follow-ups. They did blood work, something is coming back. We can now review. The community health worker can now take the results back for what comes back later and say, hey, your blood work showed this. This is what the doctor is advising. If they need to talk to the doctor, they can now do telemedicine again with that person. But at least on that one day, we're able to get a blood draw station that they can draw blood from like 300 people. And all those people maybe just has to get up and walk 5 minutes to your stand, do what they need to do rather than find money, enter bus, sit in traffic, get to the hospital, take a long queue, those kind of things that just add up into taking the whole day from them.
How can someone get access to Iyewo?
Depending on the customer segment, the most popular would say the market women. The market women will get access to us either when our agents are directly in the market canvassing, or through their market leaders when they are introducing us to them. And so they physically, somebody's telling them about us, they see us, we register them in person, or their representative registers them in person with us. And that's it. And then they start contributing, start paying their subscription fees, and see us, see our clients at their store every week. It's very simple and straightforward for them. For other MSME owners who are not physically in the market, they will definitely find us online, our website. They can download our app, Instagram, Twitter, TikTok. We're there. We're in a number of, SME communities also, just talking to people and educating people. So those that aggregate SMEs are also opportunities. Download our app or reach out to us. I'm interested in your product, and we'll just walk them through. They can download the app, and on the app, they would now see steps of what's access to, what kind of coverage do you want, or what is your price range, and select and register from there.
How does the health saving wallet feature help users plan for their healthcare needs?
What it does is it allows for planning. I mean, but it varies. The usage would depend on individual personalities, and there are people who like to save for a goal, right? And so somebody could set up a goal. They're diagnosed, oh, you have hypertension, all things being equal, your blood work, your medications, whatever it is, consultations, everything you will need for the year, right, is going to cost you, let's say, 100,000 naira, right? They kind of do like a financial planning with you. That person now knows, okay, every month I need to save maybe 8,000 naira, or let's even say 9. And they could round it up and say, I'm going to save 10,000 naira every month. And if they decide that I will save 10,000 naira every month so that I can pay for my medicine, pay for this, and I'm not running around looking for money, person can decide 10,000 naira. Okay, maybe every week I'll just put 2,500. You can decide, okay, set an alarm, do it by yourself, or just do an auto deduct where every week or every Friday it takes out 2,500 naira. And at the end of the month, you have your 10,000 naira. And from that wallet, whatever you've signed up for, whatever you need to pay for, if it's automated like subscription with us, that automatically becomes deducted. Whatever balance is left in your wallet, you need to buy medicines, you can just tell them, oh, take it out of my wallet. So that's what it does. And then for people who also it, so those are for people where affordability is not so much of a problem. It's just that having a stash away. So that's one group of people. But there are people who affordability is actually an issue. For instance, the pop-up clinic we're doing, the price we've calculated is minimum 25,000 naira per person. You're gonna get a cardiac screen, you're gonna get an eye screen, blood work, medication, so many other things that if they went to a regular hospital, it would actually cost them more. But guess what? That 25,000 naira, if somebody walked up from that market that day, it would be a problem. So what have we done? We've pre-informed them and said, start saving. So some people are saving 500 naira per day towards that event. Some people are saving 1,000 naira per day towards that event. What tends to happen over the time since we've started is we have people who, even when they sign up with us, so saving towards a goal is one, but they've signed up with us, your blood pressure is high, but you don't have 3,000 naira, the subscription fee at the beginning of the month where we're seeing you at. But we give them the grace to say, okay, your blood pressure is high, we're going to start, put a minimum of 1,000 naira down. And over the course of the month, while you receive the service, you will now pay up in bits. So there can be pre-usage installment contribution or micro contribution, and also post-usage or concurrent use micro savings or installment payment. So that's how it works. And it's just to allow for affordability. And like I mentioned, we are targeting nano, micro, small business owners, many of whom they're daily earners. Their sales goes up and down. Nobody knows, we are not sure. They are not sure. The market is not sure what day somebody is going to come and decide to buy 500,000 naira worth of goods from you, or the day that you would sit there all day and there's no sales. But they're now able to plan, okay, so when they make sales, let me put money aside. And then when there's no sales, they have money set aside.
How do you ensure that Iyewo remains both affordable and high quality?
For affordability, one of the things that we're doing again is the human capacity or human resource. For healthcare, honestly, human capacity is one of the costly expenses in operating any healthcare thing. Then there's infrastructure, and then there's equipment. And because we're physical first, it requires a lot of human capacity. First of all, globally, we don't even have enough healthcare workers, not to talk of Nigeria. But there are cadres of different categories that are in the health force. And in medical/clinical, there's the doctor that also they have cadres. You have the specialists, you have the super specialists, and you have the generalists like primary care doctors. But aside that, you have nurses that are trained in community health. So they are trained to make diagnoses and treat with protocols in the community. You also have community health workers who also are trained to be able to diagnose, triage, treat, or refer. And so we use a lot of community health workers and community health nurses to be able to do that. It costs us less and it makes it easier. You don't even have enough doctors. And if you had to pull the doctors that you had, it's going to cost more. So there are other cadres of people that have been trained to do this. And so that's what we're doing. And that reduces the cost, the number of clients. We do our best not to overburden them with too much. And also the schedule of the visit. So all of that, those are things that, just figuring that out to try and make a nice maze that comes to affordable. In terms of quality, it really is about one, having staff who care and training them to ensure that empathy and compassion is reflected in what they do. And they also take time because it's human lives and you need to just be attentive to details. Those are the things that affect the quality. If you rush through it, you make mistakes. Also, you're not courteous with clients. Those are things that affect the quality. Anybody can be giving a script, a protocol to say, do 1, 2, 3. and you train them. But yes, having formal training helps, especially for the lower skilled workers, lower skilled health workers, but also just training them in customer service. That's part of what impacts the quality. Aside them doing their work, obviously, we have physicians and we do regular reviews of what is happening, what the protocols are, what are the new standard of care that we can institute.
What challenges have you faced in building trust with patients in a digital health platform?
We're still a very face-to-face community and people. So people would still say, oh, they would rather, try to see the doctor in person, even when they come to our clinic and you're like, oh, the doctor is not on seat or they're doing something else, we can do it. Telemedicine, they'll tell you they'll come back. But I think that as we have built gradually to those that we've insisted, like, no, it's not a problem or it's urgent enough, you really need to see a doctor, and they get the service, they get the care that they need, they feel better at the end of the day, and again, you're treating them with respect. That I think has been something that um has really made a difference. Treating people with respect and courtesy and dignity has made it such that even when there's an error, they are willing to overlook or correct or bring it forward nicely and subtly, give you the opportunity to correct or improve on that. So I would say that it's just what we're used to as a community, working in and seeing people. And then this new thing is coming. But if the implementation process just has a bit more care with it, gradually people they take to it.
As a female founder in health tech, what have been some of your biggest lessons or challenges?
I would say start small, research, find community, research what you are doing, research what has been done around it, the players, what are the adjacent things, right? I'm delivering healthcare. Part of what we're doing also requires delivering medications to our clients. That requires some kind of procurement, logistics, right? And looking for players who are already in that industry. Like our health wallet requires a financial process. So doing that research, a lot of those things, if I'm not primarily a finance person. So those are some of the challenges that the adjacent processes that feed into the core of what you need to do, that creates an enabling environment for you to do your work, especially in regions like ours. It's very, very important. A lot of founders get burdened with trying to solve for enabling things so that they can focus on their core. And I'm really trying not to get carried away with doing those. So again, researching, doing a lot of research on the adjacent things that you would need to have in place to be able to do your own work. Who are the players in that industry? Build community, talk to people. Is gradually making it easier and getting support. And then starting small. We all have big dreams, but just being able to distill it down. What is the simplest form of this? And many times you focus on, you want to build it and make it look pretty, or let it be functional. Yes, yes, yes. Oh, it has to be great. And you take so much time in building, and then you get to the market and there's all sorts of problems that you could have started, just build a little one, test it out, come back, add one more step to it, test it out, come back. Just because sometimes we're not necessarily business people, we just care about the thing. And and the thing for us is like this 360, and that's what we're focused on. So s- find someone to help you distill it down into the simplest form. Can you make it modular so that this is step one, this is step two, these are the milestones, and have a structure. Having a structure helps. Um, and I think having community, having a structure, and taking care of oneself. That's very, very important as a founder.
How does a partnership with BGIS help EAO reach its mission?
So being in the BGIS program has been helpful because sometimes, they're telling you when you're starting a thing and you're wondering how it's going to work. But being in it and experiencing it is different because there's hands-on support. They're sitting with you to really look at your problem. That we have like lectures and facilitated sessions. People are coming to talk to you. But again, I feel like there should be criteria for founder fatigue, founder lecture fatigue, right? You attend all these things, you hear the same thing in different programs over and over. And so what makes this one different and stand out is after listening to all that, BGIS is asking you as a founder what specifically is the challenge that you have in your business. Let's sit down and look at it. Is this really the problem, or is it what you think is the problem? And then how do we solve it with you? How do we help you solve it? How do we teach you how to solve it? Or do we bring in people to solve it for you? So there's practicality to what is happening. People are not just throwing resources at you and telling you, go figure it out. It's like, we'll sit with you, walk through it, develop framework, test. Okay, so we've developed this, go test it, come back, let's discuss it. What else do we need to do? And, defining endpoints. Are they reasonable endpoints? Are they reasonable goals? Let's define it. Let's decide on it. And then just, it's really it's collaboration. Like really, it's not just the thing you're attending and listening and yeah, it's whatever you make of it. No, they are working with you. And I think the working with you is the big part. And that's really amazing. So yeah.
What is your long-term vision for Iyewo? Where do you see it in the next 5 years?
For Yewo, the vision is to build a primary healthcare network. Primary healthcare network that now feeds into all of these hospitals that are secondary hospitals and tertiary hospitals. But to build a primary care network in the country and across the region that helps to improve the health outcomes for our people and improve our health and daily lives significantly. In the next 5 years, because that's like long term, in the next 5 years, let's see. I think in the next 5 years, it'll be great if we have footprints and clients across the country, especially in markets across the country and other business owners, and have, I would say, physical clinics. I mean, we plan to have mini clinics co-located in markets. So I would say that in the next 5 years, to have footprint across the country, in several markets across the country, but also have mini clinics / kiosk clinics co-located within markets so that we can bring more comprehensive health and support closer to the people who need it the most.